Awarded more than £60 million, the National Institute for Health and Care Research, Manchester Biomedical Research Centre, brings together world-leading researchers based at 6 NHS trusts and the University of Manchester to drive health improvements and lasting change for all. Transforming scientific breakthroughs into new diagnostic tests and life-saving treatments, we deliver cutting-edge research to improve lives within 13 different themes grouped into 4 clusters. Let's hear from Professor Bill Newman about what our researchers from the High Burden Under-Researched Conditions cluster are working on.
So our cluster is made up of 3 themes: rare conditions, hearing health, and mental health. These are health problems that affect lots of people, and there's not been much research done in these areas previously. And so we're bringing together our understanding from those different areas to work together and make more progress. A rare condition is one that affects less than 1 in 2,000 people. So individually, these conditions affect a very small number of people, but because there are so many of them, at least 7,000, across the UK, they affect 3.5 million people. And what we're trying to do is trying to diagnose those conditions more quickly. We're trying to identify ways to prevent them, and we're trying to find ways to treat them. Hearing loss is another health problem that affects lots of people. It affects children, but as you get older, more people develop hearing loss, and it can be associated with other health problems like isolation and dementia and other health difficulties. And within this theme, we're trying to understand in the same way how you diagnose it quicker, how you prevent problems, and how you can find different ways to treat it. For mental health, and similarly, we know that there are lots of people affected with a whole range of mental health problems. That could be anxiety or depression. It could be schizophrenia or a really severe form of mental health issue. They need to be diagnosed more quickly, identify ways that they can be treated more effectively, and try to look at ways that we can prevent them. So you can see those 3 areas of diagnosis, prevention, and treatment are common across our whole cluster. The main benefits of the cluster approach are by bringing people with different skills and different expertise into the same space and bringing different approaches to try and answer some of the difficult questions. So previously, we wouldn't have necessarily interacted with each other, but by coming together, we can show that there's common themes between our work and make much more progress. I think the main benefit to patients are that we're looking at answering the health problem questions that patients have. All 3 themes have a real emphasis on speaking to patients, asking them what are the areas we should research most, what are the big problems, and sometimes thinking about those areas which overlap between mental health and rare conditions, or mental health and hearing loss, and understanding that if we work together, then we can address sort of health issues that really haven't been thought about previously. There are a number of areas where we're already working together, which is really exciting. So a particular area is in psychology, which is relevant to lots of different ways in understanding how people respond to different health challenges. So we have a project in rare conditions where people have experienced the death of a close relative, often a young person due to a heart condition. Understanding how that affects people, what you can do to help them, is going to be really important. So bringing psychology into an understanding of that rare condition can work very effectively. We need to understand that more, but we also need to include those individuals into research to really answer the challenges that they have.